Greetings, ladies and gentlemen. I would like to thank you for the committee, the Congress, and the conference, Third International Rast Music, especially for Dr. Hassan Said Totop. I would like to talk about my research. This is about the box music therapy. I'm Professor Junita Batubara from Universitas HKBP Nommensen Medan, Indonesia. I'm one of the lecturers in the music department. My field is the theory and composition. I'm also one of the female composers from Indonesia. Since 2019, I have created a tool for the therapy where the idea emerged when I saw my brother affected by drugs and dying. Since then, I have had a desire to see how my composition's music can help people who need it. Not much has been done in experimenting with the music therapy tools that I created, but I'm sure that one day it will develop. First, music therapy as a supplement for patients suffering from nervous disorders. Why do I say that the therapy music I created is a supplement? Because the therapy music that I created is as an accompaniment to the medicine that must be consumed by patients. I created BmT with my psychosis friends, where we first created this BmT, which was very simple. In BmT, there are only 3 pieces of music by me. Then, as a BmT research developed, the packaging and component in BmT increased. Box music therapy, BmT is one way to carry out therapy through music. BmT is a passive in a nature, meaning that from the perspective of the world of therapy, BmT was created for active listening, not playing. We can look for the pictures in my PPT. Box music therapy is a music therapy tool that has a square shape. It's like a box, which is designed to meet the needs of the community. In BmT, there are components that support the working system of music therapy. These components are galvanic skin response, or GSR, sensor, and the second MPX PT50 DP sensor, and the third on-off button, fourth music selected button, fifth volume, sixth monitor the results of music therapy, seven earphone. We can look the testing the performance of BmT. Researcher observes whether the headset and how the patient set relax. After that, the researcher will ask which music therapy number will be played as a music therapy for the patient. Usually, the duration of therapy music in BmT ranges from 3 minutes until 7 minutes. During the process of listening to the therapy, music according to the patient request, the researcher observes the number on the BmT monitor screen. This is done to see and confirm the number that come out when the therapy music is finished. So the patient's stress level is known. The final figures for both GSR and BPM will be recorded by researcher as a reference to see the effectiveness of music therapy in reducing the patient's stress level. After completing the recording, the researcher conducted brief interviews with the patients to get their perception regarding the music they heard and what they felt both during the music therapy and after the music therapy was completed. BmT novel. First, previous research on drug and hypertension patient, and the second, therapy music is created by the composer using element of a natural sound, bird chirping, river water, wind sound. Wind sound as a musical effect and created simple melody at the octave level. And the third is the addition of therapy music selection component and volume setting. This is the result of her research on natural sound. Like I'm saying like that, it's about natural sounds, bird sound, wind sound, river water sounds, rain sound, and human voices. Research into the sound color of each of her works began with the research in Tanjung Malim, Malaysia, research in Medan City, research around Parapat, and the voices of the native people on marginalized trip in Malaysia. There were 16 pieces of therapy music created for BMT. First is After Rain Comes Sunshine, Aktivitas, Alam Menyapa, Human of the Storm, Impian, In the Morning Shade, Ku Bersyukur versi 1, Ku Bersyukur versi 2, Renungan, Senandung Alam, Senandung Bidadari, The Power of the Dream, Suara Alam, Suara Air, Song of an Angel, and The Blessing. This research was conducted using a quasi-experimental method with a pre-test, post-test control approach. This research involved patients from the neurology unit at Adventist Hospital Medan as respondents. There were 35 neurological patients who were given music therapy treatment using BMT. Respondents were outpatient BPJS in the Indonesian language. The BPJS is a government insurance. Patients who came to Adventist Hospital in collaboration with Dr. Rustam Sipahutar. And the patient once a month for control and medication collection in the neurology poly unit. This is about the results when I do my research in the Adventist Hospital. The hospital provides special room for the music therapy for patients from Dr. Rustam Sipahutar. The room is very educated and really support this therapy program. For the patient, the number of patients was 35 people, and the gender is a female and male. Female is 65.71%, and male is 32.29%. And about the ages, the age is 19 until 84 years, and the patient received 2 until 3 music therapy treatment. And the number music, the result of the treatment showed that song number 8 is Ku Bersyukur versi 2nd, and the number 7, Senandung Bidadari, were most frequently chosen by patients. And for the BPM and GSR, we can look the BPM. Before treatment, the range is from 39 until 101, and after treatment is 36 until 63, with a range with average is 68.57%. And about the GSR range, before treatment is 247 until 704, and after treatment is around 552.78% until 539.79%. Male patient experience a decrease of 64.89%. Okay, this is the patient who do the treatment for music therapy. This is female and male, and the room is a very quiet, and they do is the relax, sit down on the chair. Thank you.